Hi, my name is Lesa, and I'll be going over the difference between VA, Tricare, Tricare for Life, and ChampVA. For Tricare, I'll be going over what is Tricare insurance, who do they service, who administers Tricare insurance, how to check for Tricare eligibility, how to register Tricare plans, how to obtain a Tricare referral and authorization. For Tricare, service current active military service members and family. Tricare is administered by Healthnet. Tricare has 3 regions, West, North, and East. Hawaii is in the West region, and Healthnet administers to Triwest patients. How to check eligibility? You would use the Healthnet eligibility website. You can click on the link here also to go on to the website. If you need access, please send email to lisa@llagme@usera.org. Or you can also call Healthnet to verify eligibility at this number here. How to register patient. Tricare Select, formerly Tricare Standard, which is similar to a PPO plan. On HPH Epic, use the Healthnet Tricare Select. Payer ID and plan ID number you would select in Epic. For Tricare Prime, similar to a managed care plan, on HPH Epic, use Healthnet Tricare Prime. Payer ID and plan ID here. For Queen's Epic, for both Tricare Select and Tricare Prime, you would use Tricare West Healthnet Federal Services with the payer ID and plan ID numbers shown here. How to obtain referrals and authorizations. For Tricare Select, formerly Tricare Standard, no referrals needed. Requires prior authorizations for procedures. Tricare Prime, like an HMO, requires referral from patient care manager and requires authorizations for procedures. Prior referral and authorization requests are obtained on the Healthnet website. If you are unsure of needing referral authorization, a Is Approval Needed link is available on the website. Healthnet processes routine requests within 2 to 5 business days and medically urgent requests in an expedited manner. Please do not schedule appointments or resubmit requests if you are awaiting a response. Tricare for Life service Tricare eligible beneficiaries, typically at age 65 or under age 65 with certain disabilities. Tricare for Life is administered by Tricare, WPS, Military, and Veterans Health. Tricare for Life is a program like a Medicare supplement plan coverage for qualified Tricare beneficiaries who has Medicare Part A and B. Medicare and Tricare coordinate Tricare for Life benefits to minimize out-of-pocket expenses. Tricare for Life will always be the last payer to Medicare or other health insurance. How to check eligibility? Use the Healthnet's eligibility website. Must have Medicare Part A and B to qualify for Tricare for Life. How to register for patient? In HPH Epic, use Tricare for Life with payer ID and plan ID shown here. And on Queen's Epic, use Tricare for Life, payer ID, and plan ID shown here. How to obtain referrals or authorizations. Tricare for Life, prior authorization is not required under Tricare for Life when Medicare is the primary payer. However, when Tricare for Life becomes the primary payer, Tricare prior authorization requirements apply. The only time Tricare for Life will be primary is when patient is under age 65 with certain disabilities. Prior referral and authorization requests are obtained on the Tricare for You website. This is the Tricare referral authorization process through Healthnet tree. These are the steps that are needed in order to get a referral authorization through the Healthnet website. One thing to remember is for Tricare Prime, a prior referral request is needed from the PCM, and all other Tricare plans, including Tricare Prime, requires prior authorizations for treatment and procedures. So this is a copy of a Tricare Healthnet referral authorization letter. Everything highlighted in red is important to the clinic and the billing department. Please be sure to scan this letter in the patient's chart. If you do not receive the letter by fax, you can also retrieve the letter on the Healthnet website. So this is how the Healthnet website would look if you enter the patient's information. You can either select these 3 links here to see if an approval is needed, to submit the authorization, or for the authorization status. On the authorization status page, there will be a view authorization letter, which will show the letter that was previously shown. Make sure you print and scan into patient's chart. Okay, so this is a copy of a screenshot in Epic of the Healthnet Tricare registration. Please be sure to enter the subscriber sponsor's social security number or the patient's benefits number located on the back of the patient's military ID in the subscriber ID field here. Any other ID number entered into this field will hit a claim edit work queue. Please do not use the patient's DOD number that's also located on the military ID. Here is a screenshot of a Tricare for Life registration in HPH Epic. What is Veterans Affairs? Health insurance. Who do they service? Who administers VA health insurance? How to check for VA eligibility? How to register VA? How to obtain VA authorizations? Veteran Affairs service retired military service members. VA is a closed network health insurance similar to Kaiser that is administered by Triwest Healthcare Alliance, Community Care Network, also known as CCN, no relation to Healthnet. CCN is VA Patients Community Care Network similar to Kaiser Health Insurance, closed network, is managed by the local VA Hawaii Region 4. How to check for eligibility. There is no need to check eligibility as you would obtain authorization from VAMC or Triwest Healthcare Alliance. And this would confirm patient's enrollment prior to scheduling the patient's appointment. How to register patient. Triwest Healthcare Alliance, VA, in HPH Epic, you would use Triwest Healthcare Alliance, CCN, payer ID and plan ID number shown here. And on Queen's Epic, you would use VAPC3, payer ID and plan ID number shown here. Veterans who are entitled to Medicare or have other health insurance may choose which plan will be responsible for payment for services covered. However, if services were authorized by VA at the present time, we are only allowed to bill VA Triwest Healthcare Alliance. VA Triwest Healthcare Alliance should be the only selected coverage linked to the visit filing order in Epic. When a veteran chooses to use their Medicare and or other health insurance, services will be paid assuming coverage and eligibility requirements are met. Claims cannot be submitted to VA Triwest Healthcare Alliance and Medicare or other health insurance for the same services then. How to obtain referrals or authorizations. Veteran Affairs Medical Center or Triwest Healthcare Alliance, CCN, makes the appointment for the veteran and then faxes an authorization to the servicing provider. The servicing provider must have an authorization on file before scheduling or rendering care to ensure payment for services. Prior authorizations are required for services and procedures under CCN. If provider renders care without an authorization, they risk losing reimbursements and may not bill the veteran. Additionally, VA requires medical documentation for all services to ensure coordination of care for veterans. VA will request notes shortly after initial visit to confirm medical necessity, typically requested 14 days from initial visit. As of February 15, 2021, all emergency notifications must be reported through either emergencycarereporting.communitycareva.gov or by calling the number shown here. Email and fax will no longer be accepted beginning March 1st, 2021. And this is the Veteran Affairs Authorization Process through VA/MC or Triwest Healthcare Alliance tree. These are the steps that is needed in order to get a referral or authorization. This is a copy of a Veterans Affairs authorization letter through Triwest Healthcare Alliance. Everything highlighted in red is important to the clinic and to the billing department. Please be sure to scan the authorization letter in the patient's chart. This is another form of an authorization letter that is received by the Veterans Affairs Department for Triwest Healthcare Alliance, CCM. Everything highlighted in red is important to the clinic and billing department. Please be sure to scan this also into the patient's chart. Also listed at the end of the letter should have a method where to submit the claims. So even if this is coming from the Veterans Affairs Department, here will show you that you would have to submit the claim to VAPCC3. That will be the Triwest Healthcare Alliance, CCM. So here is a screenshot of how a Triwest Health Alliance VA/CCN is registered in Epic. So because you would need to use the VFO in the Visit Info tab under the patient's name folder and click the Visit Account and Filing Order button. It is very important to remove other coverages when an approved VA auth is on file and will be billed for this visit or encounter. You can follow these steps here when clicking on the Visit Account and Filing Order. You would X out the Medicare or the other health insurance and just leave the VA Triwest insurance here and click Accept. ChampVA service beneficiaries are the spouses, widowers, children of a qualifying veteran. ChampVA is administered by the Veterans Health Administration Office of Community Care in Denver, Colorado. ChampVA is a health benefit program in which the VA shares the cost of certain health care services and supplies with eligible beneficiaries. An individual who is eligible for ChampVA is not eligible for Tricare. A beneficiary can have other health insurance and or Medicare Part A/B. ChampVA will cover the costs not covered by Medicare, except Medicare Part B premiums, and will pay after any other health insurance. ChampVA will always be last payer to these coverages except for Quest plans. How to check eligibility. Beneficiary has a ChampVA ID card, or you may call VHA/CC at the number shown to talk to an agent, or by using the phone's keypad to input beneficiary's social security number. How to register a patient for ChampVA. In HPH Epic, use ChampVA, payer ID, and PAN ID shown here. Also in Queen's Epic, use ChampVA, payer ID, and PAN ID shown here. How to obtain referrals and authorizations. Referrals to specialists or diagnostic tests are not required as long as they are medically necessary. Prior authorization is required for DME with a purchase price or total rental price of $2,000 or more. Mental health substance abuse services, organ and bone marrow transplant, dental procedures that are directly related to covered medical conditions requires prior authorization. And this is a screenshot of how a ChampVA is registered in Epic. Okay, so if you wanted to review or see this again, you can always click the link below. And also for all the registration screenshots, there's a video that you can also watch on YouTube by clicking the link below. Thank you. mistake. I just stopped, I paused, and then take a break, you said. You're recording already. Oh my gosh. Okay.
Why not? Didn't you just say I want to be ready?
Okay, I'm ready. Okay, I'm gonna start.